I'm Nicholas Torres. I'm the president of the Network Towards Unity for Health, an official non-state actor of the World Health Organization. You, like I, have probably always had access to high-quality healthcare and competent practitioners. This is not the reality for many millions of people across the globe. We've created the Global Health Network of Networks, powered by the technology HiveBright, to connect the globe to learn with and from each other. Our global challenge is that healthcare disparities exist across the globe and is based upon where you were born and live. We believe that if we apply the social accountability standards, principles, and practices via our ISAT tool, then we can increase health outcomes for everyone across the globe. Using HiveBright, we are working with 20 countries across our globe to scale and replicate our technological tools to increase the skills and competencies of the health workforce, applied to 6 particular populations, including indigenous, tribal, migrants, refugees, remote and rural, elderly, and children with disabilities.
Hi, my name is Anupriya and I'm the coordinator for all the Centers of Excellence. And I will take you through our technological platform, which is TUFH.org. So this is our platform. And here, if we go to the groups, we see that all the Centers of Excellence have the exclusive page on our platform. And as an example, if I click on TUFH Indonesia and go to this group, so here on the top, they can click to perform many functions such as live feed, add members, update news, media center, and also run specific programs and projects. In addition, they can access training tools to better serve the 6 populations, that is aging, indigenous population, remote and rural, migrant and refugee, IDD population, and women. In addition, they can also access the Social Accountability Fellowship and Teaching Fellowship tool to increase the skills and knowledge of the local leaders.